After last week's focus on dog arthritis, this week is one for all of you cat owners, although don't worry, I've got dogs covered too as I dive into the challenge of picking up heart failure in cats before moving on to the cause of blood in your cat's stool and then finally the risk of bleach if swallowed by your dog or cat. But before I get into all of that, here's the intro.
Welcome to Call the Vet, the show that answers all your dog and cat questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
Hi and welcome to episode 26 of Call the Vet. I'm Dr. Alex and this is the podcast where I answer whatever questions you have about how to take care of your dog or cat, about how to treat them if they become unwell, and how to keep them as happy and as healthy as possible, which is what every veterinarian and every pet owner wants. Now, I'm so grateful that you're here sharing your valuable time with me. And if we're meeting for the first time and you enjoy the show, then just make sure that you're subscribed to the podcast. I've got loads more valuable episodes lined up that you definitely won't want to miss. And you can also get your question answered to be featured on an upcoming show just by heading over to callthevet.org. So no matter what the question, whether it's to do with your dog or your cat, their healthcare, how best to look after them, just head over to callthevet.org, submit your question, and I'll answer it on an upcoming episode. And Ashley writes in with the first question, and she writes, my dog was outside and she was biting a bottle of bleach, and I just found out about that, but I don't know if she actually drank any of the bleach because the bottle, while it had holes in it and her dog smells of bleach, Ashley writes that she's acting like usual, she's running around, she's playing, and so she thinks she might be okay, but she's not really sure. So we'll start off kind of why bleach and which specific bleaches are dangerous for dogs and cats as well, should they kind of choose to lick them, to swallow them, to try and drink them. So bleach is an alkaline or a base solution, and general household bleach, which the normal one is something called sodium hypochlorite, has a pH of about 11. So pH is a way that we measure the acidity or alkalinity of a solution, of a liquid. And at that pH 11, the bleach is irritating, but it's not corrosive. If, on the other hand, we're talking about professional cleaning bleach, farm bleach, swimming pool bleach to keep the swimming pool clean, or a super strength bleach, then the pH can be between about 12 and 12.5. And what that means is it's actually over at least 10 times stronger than just a general household bleach. And at that level, it can absolutely be corrosive and is much more dangerous. Not all bleaches do contain sodium hypochlorite, but non-chlorine bleaches can contain something called hydrogen peroxide, which you've probably heard of before. We can use it for cleaning wounds and all kinds of things, actually for making dogs sick potentially. But if we're using a too strong a solution, too kind of higher a percentage of hydrogen peroxide, then that absolutely can also be quite a nasty irritant. If we're actually giving it to our dogs to make them sick, then it works because it irritates the stomach and that causes vomiting. But it also comes in a higher concentration product in these non-chlorine bleaches, and that can cause problems. So really, you know, those are the kind of the different types of bleach. If we've got a really strong one there, that's much more dangerous. If we're using it, so if we're diluting it in lots of water, no matter what type of it is, then that becomes less dangerous. And really, we get a couple of different problems. So we can get chemical burns, really with the strong bleaches around the lips, the tongue, the inside of the mouth, and then all the way going down into the esophagus, so the tube between the mouth and the stomach, and then also into the stomach as well. So if a dog or a cat is licking, if they're chewing, or if they're drinking bleach, then to start with, you can see kind of really burns around their mouth that are really sore, really red, really angry, and your dog's going to be pretty uncomfortable. But that burning also goes further down into areas that you can't see, and that's where real problems can absolutely develop. If your dog's just got into dilute or non-chlorine bleach, then that irritation that results, generally causes drooling. It can cause vomiting. You know, it only lasts generally for about 30 to 45 minutes before your dog will get back to normal. So that's with the more mild bleach solution. So it's absolutely irritating. It causes problems. Your dog might be being sick. They might really start salivating. They might be a kind of dribbly, drooly mess. But generally, we don't get any more problems than that. Now, if a result of ingestion causes vomiting, well, that can actually then cause other problems. The stronger bleaches are going to be more likely to cause that. But you can get something called an aspiration pneumonia. And that happens when your dog vomits, or if they're drinking and in a bit of distress because it's burning, they actually inhale some of that liquid. So either some of the vomit or some of the bleach that then gets into the lungs, and that is really nasty. That can certainly make dogs very, very sick, and it can kill them. It can cause all kinds of problems. With the stronger bleaches, as well as all of this burning, as a result of that, we can get metabolic issues, so breakdown in kind of normal way the body kind of metabolizes and processes all kinds of different things. Can get kidney failure, can get nerve problems, seizures, twitching, a dog can become comatose, get blood abnormalities, and ultimately, it can absolutely be fatal. So if you're worried that your dog has got into bleach, really, whether it is a mild, just general household bleach, whether it's diluted or not, or whether it's a really strong one, then to start with, if it's on their skin, just rinse it off with loads of water. A popular saying that we have is that that dilution is the solution to pollution, meaning that if something has got onto your skin, if you dilute it as much as possible, so rinse it off your dog with loads and loads of water under the tap, add a little bit of a shampoo or a little bit of a mild dish soap can help just get it off the skin. That's going to reduce any burning that might take place. You should also encourage your dog to drink. That can, again, further help to dilute it, especially if it's kind of going down into the stomach. So encourage them to drink. Now, dogs will often drink and eat what's put in front of them. Cats, it can be a little bit tricky. So as well as just using water, you could maybe add a little bit of tuna juice or some milk as well, just to encourage your dog and your cat to drink, just to dilute whatever it is that they've swallowed or they've ingested. Now, if it's known to be a strong bleach, if you know your dog has got into a strong bleach, if there are any signs of chemical burns around their mouth, or if they're not back to normal in about 45 minutes, then absolutely you need to be getting in touch with your vet straight away. These aren't chemicals to mess around with. We can get some serious burning that ultimately can be fatal. So, definitely get in touch with your vet. The other thing to say is actually don't make them vomit. Although this causes vomiting, if your dog or your cat has got into it, you don't want to actually make them vomit. And the reason for that is that you actually get more burning as the bleach comes back up. And burning in the esophagus is what's really severe, and that's really challenging to treat. So don't make them sick. Obviously, with most things, prevention is the best thing. So keep your dog shut away when you're cleaning, keeping them entertained with a toy while you're doing the cleaning, while you're mopping the floor. So that could be with a stuffed Kong or a licky pad or something like that. Clean up any spills straight away, and absolutely store bottles in lockable cupboards or cupboards with a child safety latch or something like that, so that your dog can't get into them. So, just taking a few steps, just thinking a little bit about it, because although we would like to assume that our dog and our cat, there's no way, why would they ever get into the bleach? Why would they ever drink it? Why would they chew a bottle of bleach? Well, they do. It does happen. So just take some steps to prevent that from ever becoming a problem. And then before I get into the next question, I just wanted to let you know about my free pet poisoning checklist, which just runs through all of the common food poisons for your dogs and cats, as well as poisons that you'll find around the house, just so that you can go through, you can check them off, and you can make sure that the potential for your dog or your cat becoming poisoned is greatly reduced. Poisoning is one of the true animal emergencies, and if we can reduce the chance of that, then all the better. So if you're interested in getting that free pet poisoning checklist, just head over to callthevet.org and sign up for the Knowledge Vault, where you'll get also access to all of my free downloads. And I've got loads of free guides and ebooks and checklists and charts and calculators and that kind of thing. So just head over to callthevet.org today. The second question on today's show is from Gamefuller, who unfortunately writes, "My cat recently died on Friday, and I believe that this was because of heart failure. I want to know if I could have done anything to prevent this or to potentially save him." So heart failure in cats, it's often a really tragic condition, and clearly it's caused the death of this cat. But really, no, there's nothing that you could have done to prevent this or to potentially save your cat, I'm sure. So heart failure in cats, it really can be the silent assassin. So in 55% of cats that suffer from heart disease, there'll be absolutely no symptoms of them suffering from any kind of heart problem. So that's over half of cats with heart disease won't actually have any symptoms. So there's actually just no way that you would ever know that there is a problem there. And the main cause of anaesthetic death in otherwise healthy cats is really just because of this previously unknown heart issue. So these cats they're checked over, they maybe have blood tests, they're certainly examined, they're monitored very closely, but we just don't know that their heart is struggling until they unfortunately die. And that's, the case with an awful lot of cats. even those cats that do have signs of heart disease and do kind of show signs, they are really subtle. They're very difficult to pick up on. Cats are really just great at hiding the fact that they're struggling. They're hiding their fact that they're kind of quieter. They don't do much exercise. They may be withdrawing to themselves, and we just don't really notice. They may just spend a little bit more time sleeping, or they may be out of the house and you assume that they're exploring, but actually they're just kind of tucked up under a hedge, kind of sleeping, relaxing, because if they do anything, they become very short of breath. So heart failure in cats can be very, very challenging, if not impossible, to know is kind of going on, bubbling under the surface. So another thing that we will often get in cats with heart failure, and the first sign that they've got a problem, is if they suffer from a blood clot. So we call that a feline aortic thromboembolism. And what happens there is that the kind of flow of blood within the heart, it becomes turbulent, and actually in some parts it becomes very stationary, and then you get lots of little clots forming, which can form bigger clots. Those big bits of clot then can break off and go around the body, and they often become wedged and completely block the blood flow to one or to both back legs, which is incredibly painful and is really very, very serious, as you can imagine. So, how common is heart failure in cats in general? Up to around 25% of cats, all cats, will suffer from some form of heart disease. 30% of those cats suffering from heart disease will actually die because of their heart disease. So that's another thing to consider. Even if a cat does have heart failure, even if a cat does have heart disease present, only 30% of those will die because of that heart problem. I say only, but we think that actually heart disease is a really serious condition, and it is in those that suffer from heart failure. But a lot of cats will have this kind of heart disease bubbling away under the surface, but it actually doesn't kind of end up causing any problems, and certainly doesn't resulting in them dying. But all of this works out that about 8% of the cat population as a whole will have heart failure and die as a result of that heart failure. So it's a really massively significant disease. Now, certain breeds like Maine Coons and Ragdolls, they are even more likely to suffer. So they've got a genetic predisposition to suffer from heart failure. So, we should potentially be a little bit more observant and vigilant in monitoring those cats, just to check that there isn't any kinds of problems. And most cases are in middle-aged cats. So those are the cats that are more likely to come down with heart disease, start to go into heart failure, or die from heart failure without actually showing any other signs of problems. So, what can we do? Well, we need to pay attention to the signs of heart disease for those that are showing signs. Now, a murmur is one sign of heart disease. So if you're listening to your cat's heart, or if your vet's listening to your cat's heart, I should say, then a murmur is a sign that there's some turbulent flow within the heart. Now, that doesn't mean that there's heart disease present. So about 30 to 50% of cats with murmurs could have heart disease present. Now, other things is a change in the rhythm, so something that we call a gallop rhythm, or another arrhythmia where the heart is kind of beating irregularly. Those two, though, are things that your vet's going to pick up when they're listening to your cat during their kind of annual check, or if they're seeing them for any other reason. They're not really things that you're going to be able to determine in your cat at home. Listening to hearts with stethoscopes, it takes a lot of training. It takes a lot of practice. So, I certainly wouldn't encourage you to go and buy a stethoscope to have a listen and assume that because you're not hearing anything, it's all right. It's very challenging in cats. What will you see at home then? Well, they'll be less active. Like I say, that can be really challenging to notice in cats, because a lot of the time when we're seeing them when they're at home, if they're outdoor cats, or maybe when we're awake, because cats are often kind of pretty active at night, they're not very active anyway. So it can be difficult to pick up on the fact that they are less active. You might notice that your cat is breathing a little bit faster. Now that's, again, it's not easy to see, but it's, not a bad idea to kind of monitor how fast your cat's breathing. Open mouth breathing is a big thing. If your cat is panting, if they're becoming stressed and they start panting, that is not normal. If they're open mouth breathing really at any time, then that is not normal and should definitely prompt you getting your cat checked out by their vet. And then blue gums, if they've got colder feet, are all signs of poor circulation, but they're often, again, happening kind of later on in the disease and are really challenging again to see. So, in this cat's point of view, no, I don't think, no, in any cat's point of view, it's really challenging to pick up heart failure and heart disease in cats. And, if you're, even with the best will in the world, if you're paying, super close attention to this disease specifically, there's absolutely a good chance that it will be missed. Well, over 50% of cats, over half of cats won't be showing any signs of problems. And then the last part of the question is, could anything have been done to potentially save him? Well, even when diagnosed, treatment is challenging in cats. Not all cats will respond well. And if a cat is in heart failure and is started on medication, then the survival rate is typically between about 3 to 18 months. So, it's quite variable, but unfortunately, it doesn't seem to be a really long survival rate compared to, maybe heart failure in other species, so dogs specifically. Now, if you wanted to know more about heart failure, I've also got another article on the website over at ourpetshealth.com, and I will leave that link in the show notes as well, just for you to read up a little bit more about heart failure in cats. And then just remember that the information that I give in these podcasts is not a substitute for a consultation and examination with your pet's veterinarian, and should not be taken as specific advice for any individual pet. I always say if your pet is unwell, if they're injured, or if they're suffering from any kind of problem, then talking to your vet is always going to be the best course of action.
Get your questions answered at callthevet.org.
And then my final question is another cat question that was sent in by Sophia over on Instagram. And you can find me on Instagram by looking at the handle at Our Pets Health. And Sophia says that my cat is having some mucus with traces of blood at the end of her stool. I've had her tested for everything possible and all tests are good. Do I really need to put her through endoscopy? I read somewhere that malt paste is effective but doesn't cure it. I'm going round in circles. So Sophia would like to know what she can do, what could be possibly causing this blood in her cat's stool, and how can we put a stop to it. So mucus and blood in a cat's stool is typically a sign of colitis, which is an inflammation in the lower part of the intestine. If it's not an inflammation, then it is due to a problem in the lower part of the intestine. If the problem is higher up and there's bleeding in the kind of the intestines higher up, so in the small intestines, then typically the blood will get digested and will come through as black rather than the kind of the bright red blood that we'll be seeing from lower down in the intestinal tract. And I guess the good news about colitis, if we're seeing fresh blood and mucus and there are no other problems, then it's pretty much always due to an intestinal problem rather than a disease elsewhere. So if we've got diarrhea elsewhere, that can be due to, organ disease, so kidney disease. It can be due to hormonal problems. There's lots of different potential causes. But really, when we've got colitis and there's no other problems, there's not vomiting, a cat isn't otherwise unwell, then it's pretty much always due to an intestinal problem, which at least narrows down the area that we need to be looking at. So some of the really common causes of blood in a cat's stool is constipation, so straining and hard stools can damage the lining of the colon and can also kind of cause damage to the anus when these really hard rocks are trying to be passed. We can get in cats something called megacolon, which is like a kind of constipation plus, if you like, and the colon, the kind of the back end of the intestines, it just becomes really flaccid and saggy and it can't contract, and so the poo just builds up and builds up. And if you see any x-rays of these cats, it's amazing. Their colon is just completely taking up the whole of their abdomen pretty much, and it's just full of poo. It's a really challenging condition to look for. Now, that's not going to be going on in Sophia's cat, because that's something when you have a feel of a cat's belly or when your vet has a feel, it's something that can be fairly obvious and certainly would prompt further investigation. Now, other causes of blood can be trauma. So if, for example, there's been a pelvic injury, or if there are bones that have been eaten or some other kind of foreign body that's been eaten, and that's causing scratching of the gut as it's working its way down. We could get anal gland disease, and that, while that doesn't kind of cause, I guess, specifically blood in the stool, you can get blood coming from around the back end of the cat and that going onto the stool, and so that makes us think that we've got the blood in the stool, where actually it's coming from kind of outside from a burst abscess. Food intolerance, scavenging, something like that can cause bloody stools, as well as parasites. So Giardia, Trichomonas foetus in younger cats can also cause that. And then infections as well. So Salmonella and Campylobacter would be two to think about, as well as there kind of being numerous others. And then finally, and I guess this is maybe where we get onto Sophia's question more specifically, is that inflammatory bowel disease and then intestinal cancer can also cause blood in a cat's stool. So How do we go about determining what's going on? Now, Sophia said that there's been kind of tests run for everything already. So, if we've got a mild disease, so if there's just a little bit of blood and mucus, and it's lasted for more than a few days, because if there's just a bit of a kind of a tummy upset that is causing a colitis, then that's going to sort itself out in kind of 3 to 5 days. There's not going to be anything that we really necessarily need to do. Feeding a bland diet can definitely help, but it will sort itself out. But if we've got a mild disease that's going on for longer than that, then a fecal analysis is one of the first things that we want to do. And even if there aren't any signs of parasites, that can be quite variable. So treating for parasites is often a very good idea anyway, regardless of the result of that fecal analysis. Assuming that doesn't correct things, then a diet trial would be something, so changing diet to see if that helps. Then an antibiotic trial to see if there is any infection. If there's something called an antibiotic responsive diarrhea, then that's something else to try. And then if all of that isn't working, then we're looking at kind of going into more advanced diagnostics. Now, if the colitis is severe, if it's kind of losing an awful lot of blood, if there's an awful lot of blood being kind of found in the stools and throughout the stools, or if we've got a long-term disease, so the mild disease hasn't cleared up after all those other things that we've been doing, then the other tests we need to look at, blood testing certainly, if it's not been done already, and that may be done earlier depending on the individual cat as well, and their history and what's going on, their age, all that kind of thing. And then we're looking at ultrasound and then biopsies, and that can be taken either what we'd call endoscopically, so with a camera. That camera kind of passes into the colon and kind of takes biopsies of the lining of the colon, compared to full thickness biopsies. So those are biopsies, kind of sections of the colon that are taken at surgery. So the whole abdomen is opened up and the whole thickness of that gut is removed. That gives us a much better diagnosis, a much better, more useful sample, which makes the diagnosis much more likely. It's clearly much more invasive though, and there are times when that may not be appropriate. Both need to have an anaesthetic, but the full thickness biopsies is a more invasive procedure, and endoscopy may well kind of be enough. We need to be aware though that if we are going, or if your cat is having endoscopic biopsies taken, that they may come back as inconclusive. And the reason that we want to do that is to separate inflammatory bowel disease from intestinal cancer. That's kind of really the main reason why we do that. The reason that we need biopsies is because that's really the only way that we can determine. Now, it may be that there is an inclination on ultrasound that's going on, but definitive diagnosis means that we need to have biopsies. And it can be important to determine whether we've got an inflammatory bowel disease going on or an intestinal cancer, because the treatments are a little bit different in the sense that if it's a mild disease, if it's a mild inflammatory bowel disease, then that will typically respond to steroids, to a diet change, to keeping up with parasite control, and also maybe using an antibiotic, metronidazole, which also has what we call an immunomodulatory function. Now, if we're looking at intestinal cancer, then we want to be using different treatments. Now, some of those treatments we will also use with inflammatory bowel disease if it's not well controlled with that initial treatment. But if we know we've got a cancer and it's not responding to that, then we would jump into kind of more advanced chemotherapy agents, which are going to be very good for the cancer, but are going to be doing nothing for the inflammatory bowel disease. So it depends a little bit on how far, I guess, you want to push things, whether you're going to be able to afford these advanced treatments, that kind of thing, as to whether endoscopy and whether biopsies are the best thing. But if you want to get to the bottom of a problem, if it's been going on for a long time and all other tests are normal, then either we need to be doing these more advanced, more invasive procedures, or we need to be trial treating and see what happens. But being aware that if an animal responds, so if, for example, you're giving steroids and diet change, then actually a small cell lymphoma, so our cancer, may well respond a little bit to that, but it's going to come back, and it may be that we could have actually treated it a lot better to start with. So, those are some things to think about there. As with all of these things, especially when we're getting into advanced disease, having an open and honest chat to your vet about kind of what you're able to do for your cat, what you're able to afford to your cat, and always being clear in your mind as well what the kind of why tests are being run, why tests are being recommended, and what difference those tests are going to make to the treatment. Because if, for example, we say, well, I'd like to run this test, but it's only going to diagnose or differentiate between two untreatable diseases, well, if you want to know which one it is, then that's fine. But if it's not going to make a huge difference to how your cat or your dog gets treated, then is it the most valuable way to spend your money? Well, that's something that's up to you, but it's an important thing to think about. And if we don't want to be doing these advanced tests, then that's absolutely fine. But we need to be aware that by doing that, we're maybe not reaching the kind of exact diagnosis, and we may be compromising, we may be kind of cutting corners and compromising the care that your cat or your dog is suffering from. So that's it for this episode of Call the Vet. Be sure to subscribe, and if you do have a couple of spare minutes and you've enjoyed what you kind of listened to, either through this episode or all of my other episodes, and there's a whole back catalogue for you to check out if you're just joining me, then I'd love it if you could leave me a review on iTunes or over at ourpetshealth.com/review, just to help more people discover this podcast. Reviews help so much with podcast discovery, and that will allow me just to help more pets. Now, if leaving reviews is not really your thing, then just sharing this podcast with a couple of your pet-owning friends or family would really be greatly appreciated. And remember too to head over to callthevet.org, where you'll find the links and downloads mentioned in today's show. And you can also submit your question there. And so until next time, I'm Dr. Alex. Take care.
You've been listening to Call the Vet. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show that answers all of your pet questions.